This is the part B of the second outline, part B of the peritoneum and peritoneal cavity, and I'm going to teach you something about peritoneal subdivision of the peritoneal cavity and something about the omental bursa. Peritoneal cavity consists of the greater peritoneal sac and lesser peritoneal sac. The greater peritoneal sac is dark purple part of the abdominal cavity, and the lesser peritoneal sac is light purple, and this is the omental bursa, which is situated posterior to the stomach, lesser omentum and liver. Peritoneal cavity, greater peritoneal sac or peritoneal cavity is divided into the supracolic and infracolic compartment. This is the supracolic compartment, this is the infracolic compartment, and border between these two parts is transverse colon. Its mesentery, which is named the transverse mesocolon, and part of the greater omentum. This is that apron-like gastrocolic and apron-like part of the greater omentum. This is the border between the supracolic compartment and infracolic compartment. Transverse colon, transverse mesocolon, and greater omentum, apron-like part of the greater omentum. This is the supracolic compartment, and this is the infracolic compartment of the peritoneal cavity. Viscera, which are located in the supracolic compartment, are stomach, then duodenum, but this superior and part of the descending duodenum, then liver, gallbladder, and bile ducts, then pancreas, except this uncinate process. Uncinate process is located in the infracolic compartment, and spleen. A root of the transverse mesocolon attached to the posterior wall or secondary retroperitoneal and primary retroperitoneal viscera from the right kidney, then attached to the anterior surface of the descending part of the duodenum, then head of pancreas, and separate the uncinate process from the other part of the head, then anterior border of the pancreas and tail of the pancreas, and left kidney. And pancreas, except the uncinate process, is in the supracolic compartment, and this is the supracolic viscera. Infracolic viscera, which are situated in the infracolic compartment, are parts of the inferior part of the duodenum, then jejunum, ileum, then parts of the large intestine, cecum, and vermiform appendix, then parts of the colon, ascending colon, right flexure, transverse colon, left colic flexure, and descending colon, and parts of the sigmoid colon, which is in the peritoneal cavity. These are the walls of the intestine and the infracolic. Supracolic compartment is divided into the smaller parts. Falciform ligament of the liver extends from the diaphragmatic surface of the liver and anterior abdominal wall, and this falciform ligament divides right subphrenic space from the left subphrenic space. These are two space or recess are located between the diaphragmatic surface of the liver and inferior surface of the diaphragm, and this recess is located is covered its surface is covered by the peritoneum, parietal peritoneum of the diaphragm, and visceral peritoneum of the diaphragmatic surface of the liver. This is the subphrenic space or subphrenic recess, right and left subphrenic recess. Posterior to the liver, there is a hepatorenal recess. This is recess between the anterior surface of the kidney and visceral surface of the liver, and it is located on the left side, and it is connected with the paracolic gutters of the right side. Infracolic compartment is divided by the mesentery or small intestine on the right and left infracolic space. This is the right and left, and this is the right, and this is the left infracolic space. Mesentery of the small intestine is attached from the duodenojejunal plexus to the right sacroiliac joint, and divide this infracolic compartment into the right infracolic space, which is right and superior, and left infracolic space, which is left and inferior. Also, in infracolic compartment, there are grooves associated with the ascending and descending part of the colon. These grooves are paracolic grooves or gutters. There are two gutters on the right side associated with, which are associated with the ascending colon, and gutters on the two gutters on the left side. These gutters are associated with descending colon. This is the right lateral and right medial gutter, and this is the left medial and the left paracolic gutter. The clinically is most important, this right lateral paracolic gutter. This is connection between the subphrenic recess, not subphrenic recess, but hepatorenal recess, and connection with the inferior part of the peritoneal cavity, and pouches between the rectum and the urinary bladder, rectovesical pouch in the male, and in the female this is the rectouterine pouch. This is the most inferior point of the peritoneal cavity. Second part of our today lecture is omental bursa. This is the lesser sac of peritoneum. This is the lesser cavity, smaller part of the peritoneal cavity. Omental bursa is located posterior to the stomach, lesser omentum and liver, and anterior to the posterior abdominal wall and retroperitoneal viscera. Omental bursa has two walls, anterior and posterior wall. It has the four borders. This is superior, inferior border, right and left border. Anterior wall of the omental bursa is peritoneum, which cover posterior or posterior inferior surface of the stomach, and first part of the superior part of the duodenum, then lesser omentum and a greater omentum, these gastrocolic ligaments. anterior wall of the omental bursa. This is the transversal section, cross section at the level of the second lumbar vertebra. These are the vertebral column, kidneys, right and left, spleen, pancreas, stomach, and omental bursa is posterior to the stomach and lesser omentum. This is anterior viscera which form the anterior wall. This is stomach, lesser omentum, and gastrocolic ligament of the greater omentum. Posterior wall is formed by the primarily and secondarily retroperitoneal organs. This is posterior wall. This is, stomach is removed, and we can see the posterior wall of the omental bursa. First, that is the part of the posterior wall, then pancreas. This is pancreas. Then upper part of the left kidney. This is the left kidney, left suprarenal gland, and transverse mesocolon and transverse colon. Left suprarenal gland, left kidney, pancreas, transverse mesocolon, transverse colon, is part of the posterior abdominal wall. Here on the sagittal section, we can see the posterior wall, pancreas, and transverse mesocolon and transverse colon. Upper border is the part of the omental bursa, between the right side of the esophagus and fissure for the ligamentum venosum of the liver. This is the short part of the, it is superior or upper border. Left border, this is the left border, is the bottom of the omental bursa, and it is situated between the splenorenal ligament, this is the splenorenal ligament, and gastrosplenic ligament, and correspond to the hilum of the spleen. Splenorenal ligament, this is the splenorenal ligament or pancreatic ligament, and anteriorly this is the gastrosplenic ligament, and this is the hilum of the spleen, and this is the left margin of the omental bursa, or left border. Inferior border usually is a place for the attachment of the gastrocolic ligament to the transverse colon, but developmentally it is the inferior border of the lesser omentum. Lesser omentum has 4 layers, 2 anterior and 2 posterior layers, and the most inferior part of the between these 2 layers is the inferior border of the omental bursa. But usually in adults, the place for the attachment of the gastrocolic ligament to the transverse colon, the gastrocolic ligament, and this is the place for the attachment of the gastrocolic ligament to the transverse colon. Right border is communication between the greater peritoneal sac and omental bursa. Right border is named epiploic foramen of Winslow, and it has 3 margin or 4 borders. Anteriorly, that is the hepatoduodenal ligament, hepatoduodenal ligament. This is the hepatoduodenal ligament, right free border of the lesser omentum. This is a cutted hepatoduodenal ligament. In here, this is the hepatoduodenal ligament. In the hepatoduodenal ligament, this is the portal vein, which is situated posteriorly, anteriorly, and to the left is uh, hepatic artery proper, and anterior to the right is the bile duct. This is anterior border, posterior this is inferior vena cave, and right crus of the diaphragm, lumbar part of the diaphragm, and superior it is the caudate lobe. This is caudate lobe of the liver. This is posterior to the porta hepatis, and inferior this is superior part of duodenum. This foramen is large and we can put 2 fingers in this foramen, and these two fingers are situated between the large veins. Anterior is portal vein, and posterior is inferior vena cave, and this epiploic foramen and these two large veins, and these large veins are very surgically important, and uh, it has are very important for the surgeons. And this is the end of our presentation about the second